we're diving into chronic fatigue syndrome, or CFS, which is a complex and often misunderstood condition. It's a debilitating disorder that goes way beyond just feeling tired. Imagine yourself during your worst proper flu episode and how totally knocked out you felt, but it never goes away. That's the kind of exhaustion we're talking about. Millions around the world experience some form of chronic tiredness, but for some, it's a sign of something more complex condition called chronic fatigue syndrome, or CFS, also known as myalgic encephalomyelitis, which is a mouthful, or ME. That overwhelming exhaustion is just one piece of the puzzle when it comes to CFS ME. It's not just being tired, it's a serious long-term condition that impacts your energy, your brain function, and almost your entire body. CFS and the term ME are often used interchangeably. Simply put though, they involve your immune system, hormones, and your nervous system not working as they should, and this then is leading to debilitating fatigue and a wider range of other often debilitating symptoms that go far beyond just feeling tired. CFS ME affects women at least 3 times more often than men, and most commonly shows up between those in their teens and late 30s. The tricky thing is, CFS ME can appear different in each individual sufferer. Some people experience milder symptoms, while others truly struggle with severe, life-altering limitations. This makes diagnosis and treatment really challenging, even for doctors. CFS ME is mainly characterized by persistent, debilitating fatigue that lasts at least 6 months and crucially does not improve with rest. Secondly, is something called post-exertional malaise, or PEM. Imagine that a short walk or even a phone call could trigger a flare-up that then leaves you bedridden for days or even weeks. That's the impact and potential of the PEM. Thirdly, is something called orthostatic intolerance. This involves feeling things like dizziness, lightheaded, or faint when standing up, sitting up, or even sometimes just when sitting or walking. Number 4 is things like muscle and joint pain. CFS ME often comes with persistent aches and pains throughout the body, particularly in the neck, shoulders, and hips and knees. Again, it can be mild, moderate, but it can be extremely severe, and this is persistent discomfort adds to your overall exhaustion of the sufferer. 5 is things like cognitive difficulties, i.e. things like brain fog. Imagine struggling to think clearly, find the right words, or remember simple things. Brain fog is a hallmark of CFS ME, impacting your work, your relationships, and daily life.